to start. A warm welcome to you from the Geneva Learning Foundation. I am Charlotte Mbuh. For today's lightning chat, we are receiving for the second time Lisa Manning, team lead for demand and behavioral sciences at the Department of Immunization, Vaccines and Biologicals at the World Health Organization headquarters in Geneva, Switzerland. She will be answering our questions today on how to build a positive experience of vaccination, considerations for service delivery. We know you are busy. That is why we are talking about a 15-minute lightning chat. And we will only extend up to 30 minutes if you have more questions. You can also decide if this topic is important to you, if it is relevant to your work. You will find links to resources in order to learn more. I'm going to ask Lisa the first few questions, and I'll be looking to you to ask your own questions in the chat. You may also raise your hand if you wish to speak. So for our Francophone colleagues, you can turn on simultaneous interpretation on your device by clicking on the interpretation icon at the bottom of your screen. Select the French language and cut original audio to hear only what is being said. Mute original audio to hear only what's being said in the French language. So right now, I'm going to start with the first question. And as I said earlier, please feel free to type in your questions in the chat or raise your hand if you want to speak. So once again, warm welcome to you, Lisa. It's such a pleasure to have you with us today. My first question is this. When you talk about a positive experience of vaccination, what are you referring to and why is it important?
Yeah, thank you so much, Charlotte, for the question, and also to the Geneva Learning Foundation for hosting this session today. This is absolutely a really important topic, so I'm really delighted that we have so many participants on the call. So to answer your question, there are two main considerations or concepts that we need to be thinking about. The first is, what is a positive experience? And the second is vaccination and what we mean by what it takes to get vaccinated, and that actual act of going to a vaccination site, being vaccinated, and then what happens just afterwards in terms of the experience of any mild side effects which can take place. So what is a positive experience and why is this important? So the experience is about someone's thoughts and feelings and their impressions and memories of something that takes place in their life. And this is really important for vaccination, because if someone does have a good experience of vaccination, that it all goes smoothly, it's easy, it's convenient, their questions are answered. If all of this goes well, it also means that they are more likely to return for vaccination in future. If it does not go well, there's a highly decreased chance that they will be much less willing to return in future. So it is very important for us to help ensure that people really are satisfied with their entire journey around vaccination. And this is, by the journey, I mean what happens in the lead up to getting vaccinated, or the lead up to being at a health centre or a clinic for vaccination. So the journey in terms of actually getting there, and whether it's at the right location, the right time, etc. What then happens on site is also absolutely critical. And then also just after. So when we talk about vaccination, it's not only that moment where someone has the vaccine administered and given to them, but it's also what happens before, during, and after that we need to take into consideration and really make this as positive and pleasant as possible. So hope that's starting to shape up this topic, and can go back to you, Charlotte, for the next question.
Thank you so much, Lisa. My next question is, what impact does building a positive experience of vaccination have on vaccine confidence and uptake?
Yes, an excellent question. Thank you. So there are many factors that drive vaccine uptake, and this experience of vaccination and all the related practical factors is just one. So if we zoom out for a moment, there are four main factors that drive vaccination. Firstly, someone's attitudes or confidence related to vaccination. Do they think vaccination is important, necessary, safe? Do they trust the vaccine and vaccinators? So there are the thoughts and feelings and attitudes that someone has. Secondly, there are the social influences, the influences from peers, from family members, from other local influencers, local religious leaders, for example. Thirdly, there are people's motivations, their desire to want to get vaccinated, or those intentions. And that's actually where we situate hesitancy related to the motivations. And lastly, there are the practical factors. And so the practical factors consist of the availability, the affordability, and importantly, these experiences of getting vaccination, the satisfaction, the service quality, the time, the location, really how easy it was for someone to get vaccinated. Did they really have to make a huge amount of extra effort to plan for it and to go out of their way, to take an extra day off work, to find the extra money for a bus ticket? And then when they got to the health centre, how were they treated? Did the health worker treat them in a very respectful and kind and caring way? And then also what happens just afterwards as they experience maybe a little bit of a painful arm or maybe a mild fever. And with a lot of vaccines, these kinds of mild side effects are really normal and to be expected. And people need to know that that will happen and what to do about it if they start to get a bit more worried. So these four factors, the attitudes and confidence, the motivations, the social influences, and these practical factors all need to come together for someone to want to get vaccinated and for us to achieve high uptake. And when we further unpack the practical factors and those logistical considerations, and within that, the experience of the services and the quality of those services, this is where this experience and those impressions and how someone will remember that journey to getting vaccinated, that is what is so absolutely critical. And if that goes wrong, it's very unlikely that someone will want to get vaccinated again in future.
Thank you so much, Lisa, and a warm welcome to you if you're just joining us. Today, we are talking about how to build a positive experience of vaccination, considerations for service delivery, and Lisa Manning from WHO is here to answer our questions. So please go ahead, type in your questions on the chat, and it is important that you focus on the topic at hand and ask questions that are relevant to your real world experience. So while I'm waiting for you to ask your questions or to raise your hand, I'm going to turn towards you, Lisa, with my third question, which is, I'm sure, I know you have started talking about this, but I want to revisit it. What are the key components of a positive vaccination service experience, and what specific considerations need to be made regarding service delivery? Because here we are talking about considerations for service delivery.
Thanks so much, Charlotte. And absolutely, we can start to unpack this a lot further and to go into much more detail on these different components of a positive service experience and strong satisfaction related to vaccination. So like I've said, let's think about it across these three main steps to vaccination. What happens just before in someone planning to get vaccinated, and all of the steps they take to think about the location, the time, how they will get there, how they will afford the bus ticket, maybe how they will inform their boss that they need to take the day off work, what they will do for childcare. Maybe someone has 4 children and they need to think about what they're going to do with those children while they go to the vaccination centre. Sometimes a mother or someone else, or a female, an older woman, needs permission from her husband, or maybe even her father, who's the decision maker in their household about whether someone can go and get vaccinated. Maybe that woman, if it's an older woman, she needs to be accompanied by someone else to help her get there. And that's the case for COVID vaccination, where we're targeting and prioritizing older adult groups. So firstly, even just before someone gets to that health center or that clinic, there's so much preparation and planning that someone goes through when they're thinking, I need to plan to go there. How am I going to do that? How will I afford to? How will I actually get there? How do I organize my life to be able to do that? And we know that today, people are so busy. People have so many other priorities that our goal as people working in programs is really to make this as easy as possible for people, this whole planning stage. So making this easy is really about making sure that the services are low cost, that someone does not need to spend, more than a day's wages just to be able to afford a bus ticket. So it's our job to make this as easy as possible and as convenient as possible, so that people should not make a lot of extra effort when they're planning to go and get vaccinated and actually going through the motions and the steps of organizing their life to be able to do this. So that's the first thing. The second thing is what actually happens on site. And part of these considerations are, okay, so someone has made all of this effort to organize their life and to be on site at the right time and place, and they get there and they have to wait for 3 or 4 hours. This is not good. They know that they've taken the day off work, or they need to get back to work urgently, or they need to go and pick up their children, and they're sitting there waiting and waiting for hours. And maybe after waiting all this time, the health centre runs out of vaccines and they're told to go away and come back the next day. This is not good. Someone will be very disappointed. And what are the chances then that they'll want to return the next day? So as part of what happens on site, it's absolutely critical to then think about all of these dimensions of not only the waiting times, but the satisfaction. How is someone treated? Are they treated respectfully? So this is not only about having the vaccine injected into your arm, but it's also about how the health worker is interacting, and all of the communications and a little bit of the conversation that takes place there, the gestures, any listening, any of these ways in which someone shows that they have concern and respect for that person, and they're willing to really make sure that, for example, when they're administering the vaccine, this is not painful, that it's not uncomfortable, and maybe sometimes someone has some questions that need resolving. So those things need to be heard and addressed also in a very empathetic way. We know that with vaccination, there's a lot of new science that has become available, particularly around COVID vaccines in the last 2 years. So we really want to make sure that people have those concerns and questions addressed. So there are all of these different dimensions that take place on site, from the waiting, the interpersonal interactions, the ways in which pain is minimized, and any other kind of gestures and actions that are taken to make this positive. And lastly, we know that just after vaccination, someone can have mild side effects. And many of these would include a mild fever, a painful arm, maybe even just feeling a little bit achy. And a lot of this is very normal and to be expected. Sometimes it's a little bit different for different people, for different vaccines, but people need to know that this is going to happen, because if it's a surprise and they're not warned in advance, this is also going to be a little bit concerning. It will raise questions in someone's mind and they'll be like, no one told me about this. What does it mean? What should I do? So a person needs to be told, this is what's normal. It may or may not happen, not for every, but sometimes they need to be informed, okay, it could be a little bit, worse. And here's what to do if it goes beyond what would be normally expected. So this entire journey from before, during, and after vaccination needs to be delivered extremely well and is part of what we describe as this experience. And we know that this is actually one of the main, most important drivers of vaccination. Yes, we know that sometimes there's hesitancy, sometimes people don't have all the right information, but if this experience is as convenient and easy and as positive as possible, we know that this is one of the main, or if not the main factor that truly shapes vaccination uptake. It is really an important point for us to focus on in all of our work. Thank you very much.
Thank you so much, Lisa. I see we have 2 raised hands and a couple of questions in the chat. I'm going to start with Chinwe Catherine Eze. Chinwe Catherine, please go ahead, unmute yourself, and to start by introducing yourself. Tell us who you are, what you do, where you're joining from, and then ask your question.
Okay, thank you very much. I'm Dr. Chinwe Catherine Eze, calling in from Nigeria. I just have 2 questions and work in Federal University of Technology, Owerri. I'm actually a public health expert involved in a vaccination campaign here. I want to ask 2 questions concerning, I know it's very necessary for mass media campaign concerning vaccination before administration and all that. I know that the problem we're having here in sub-Saharan Africa is usually based on socio-cultural perspectives of vaccine. I want to ask, is there anything WHO is doing concerning such campaigns to make people aware or to make people more receptive to accepting the vaccination? And secondly, post-vaccination awareness too. So I want to find out if there's something that can be done on that, because it will affect the acceptance. It will affect how people receive, because if you take the essential of what is going on here, many still have their social cultural perspectives. That is a kind of a big hindrance around this side. So I want to ask, is there anything that is being done by WHO to help people accept it more? Thank you.
Thank you, Chinwe. That's an excellent question and really important to address. So the first thing is to say information campaigns and building this awareness about the importance and benefits of vaccination and also where to go. So absolutely, this is really necessary, but it's not always sufficient. So we know that people can have the right knowledge and awareness about vaccination. They can want to get vaccinated. They can really be thinking, tomorrow I'm going to go and get vaccination. And then there are other things that happen in life, or maybe they find out at the last minute they don't have the money. It's really too far. They don't know how to get there, or something happens with work. So yes, information is important and necessary, but it's also not enough for someone to actually get vaccinated. And what this also means is that even if people do not always have all of the right information, we can design our programs and services and delivery strategies in such a way that it's so close to people and where they live, and so easy and convenient. And there are people there who they know and trust, and this can actually work together and be a greater force than trying to build knowledge. So we need to think about all of these different factors holistically and then say, yes, let's do everything we can to make sure that people have all of the knowledge and information, etc. They have the confidence, they know when and where to go. But if the services are too far and not convenient, it's never going to happen. So the more we actually make those services easy and convenient and a positive experience, we can actually then compensate for perhaps some of these knowledge and information gaps. And those things related to the services are what we're able to shape and act on more directly, and which have the biggest impact on people getting vaccinated. And so what is WHO doing? Another question that you had. So where I work with WHO at a global level, we're sharing a lot of information in many different ways to help support programs in relaying and making available accessible and accurate information. So we make this information available at a global level in various ways, shared with partners, shared with our social media channels, shared with programs. But then also programs have a responsibility locally to take their own actions as well, to share that information. And we know that people need information from many different sources. WHO is one of those sources and plays a key role locally in different countries, in different regions in sharing information. But we know there are many other actors, governments, civil society, other implementing partners who also have a contribution to making available this information, but also in contributing to the design and delivery of all of these quality services as well.
Okay, thank you so much, Lisa. Another raised hand, that is David Shakunashvili. You are unmuted, David, so please go ahead, introduce yourself and ask your question.
Thank you very much. Good afternoon. So thank you for this very important, for bringing up this very important subject. And I have a question. So in preparing for a positive...
Please, David, can you introduce yourself first?
Oh, yes, I apologize. I'm working for the National Center for Disease Control and Public Health in Georgia, Tbilisi, Georgia. And I'm heading the AFI reporting team locally. So you have mentioned, or it is a part of, while we're building a positive experience, building trust is crucial, right? So I have a question, or does it need to be addressed when a child, for example, feels pain after the vaccination? Do they feel some kind of, when they feel disappointment, do we have to address it? Does it have to be considered, or what's your point on this? Thank you.
Thank you so much, David. Lisa, before you come in, his question aligns with the question that's asked by Adumpe in French. He actually sent it directly to me in the chat. He says, au-delà de la douleur ressentie par le vacciné, comment gérer positivement le cas de ma fille? So beyond the pain that is felt by the person that is vaccinated, how do we positively handle AFI cases? So it aligns with David's question. Yeah.
So yeah, this is a really important topic to explore, because we also know that if there are severe adverse events and someone is injured, might end up in hospital, and there can be certain publicity on these events. There can be communications saying person X had a severe reaction to a vaccine, and this can become, cause a lot of fear and scare people about vaccination. So it's absolutely critical that these kinds of events are communicated well and not only very well handled for the person involved and their family and community, and ways in which they are kept informed about what's being done to respond and the care that's given to help that person recover. But at the same time, programs need to have preparations and planning in place so that when these events take place, the communications to explain it can be as accurate and timely as possible. And what this means is that we know that very rarely there will be severe adverse events. And it's really to be expected. These events take place maybe 1 in a million doses, but it will happen and we need to be ready. And being ready means a number of things. It means making sure that a health worker knows what to do if they are faced with someone who might be having a severe reaction, an allergic reaction, or anything else. And the health centre needs to know how to respond and what to say and do. And some of the things they might need to do is to take that person into care and refer them to another bigger, the secondary or tertiary hospital, depending on the case. But they also need to say and explain this to the person and maybe the family and other community members who are aware that this has taken place. And providing this explanation is really important, and doing this in a timely way, in quite a prompt way, and doing it in an accurate way. And what this means is that even if someone, a health worker at a local level, that health worker might not have all of the answers to begin with. Maybe this case is still being investigated. Maybe they need to find out more about what caused it and if this person's going to be okay. This is still okay. This can still be explained. So it's possible for a health worker to say, we know that this has taken place. Here's how we're investigating. Here's how we're handling it. And we will keep you all informed. And we acknowledge that we have some concerns here. This is something that we are also worried about, but here's what we're doing. And it's okay to have those concerns and to really lay the groundwork for further communications that can also follow up and resolve all these questions and concerns. So all of the communications around these events need to be planned and prepared for in advance, because the timing and doing this promptly is really important. There's absolutely a lot more that could be said on this topic, and maybe if there's a lot of interest, we could have even a separate session. But I'll leave it there for now, but excellent questions.
Thank you so much, Lisa. We are almost out of time. I would just want us to close with this question on the chat from Bawani Shankar Tripathi, who says, with the COVID experience, I have noticed that the private sector is refusing vaccination to reduce vaccine wastage, as logistically COVID vaccines were 10 dose vials, and unless 10 recipients were present, vials were not open. This, however, was not applicable in the public sector, although field visits have brought up these issues with some vaccines in the routine immunization program. Can this also impact on vaccine confidence in the long run?
Yeah, thank you, Charlotte. So, the impact on vaccination of this entire experience is, and these dimensions of even, for example, misinformation and rumors, and the ways in which this contributes to people maybe being less motivated about vaccination. So this is absolutely critical to take into consideration. And health workers have a key role in being able to respond to misinformation and rumors, and dealing with people who are not always highly willing to get vaccinated. And it's important to really remember that health workers seen as an extension of a medical system and health expertise, health workers are often well known and well trusted in their community. So it's absolutely critical that they are very well trained and well supported to be able to respond to questions and concerns and to rumours and misinformation. So there are also very many ways to be listening for the rumours and misinformation and listening to these concerns so that, again, we can prepare health workers, support them and train them, and really make sure that at the front line, they are really well equipped to be doing this critical job. And if we're not supporting our health workers well, a lot of this is going to be fragile in terms of our ability to have this and support this positive experience. So I think one of the main takeaways here really is thinking about our health workers and the clinics in which they work and those delivery strategies, and really making investments in that and supporting the health workers, their training, and really making sure that we're hearing from communities about their needs and whether those services are as responsive and possible and positive as possible to respond to the needs of those communities. So really, we do need to get behind these important investments and strategies as much as possible. Thank you very much.
Thank you, Lisa. Is there any resource, or are there resources that you can point participants to around this very engaging topic? Because from the interest, the comments in the chat and the raise hand, because since we're out of time, I know that many people will want to learn more and know more about on how to build a positive experience of vaccination.
So yes, we are actually literally a couple of weeks away from publishing new updated guidance and tools just on this exact topic. So I will make sure that I share that with the Geneva Learning Foundation. They can circulate that widely to this entire community. I'll share a link to the webpage where all of this will be published. I've put it in the chat here, so keep an eye on this page over the next few weeks, because this is where it will be published. There's already some useful tools that start to explain what I just described on that site, but there will be much more coming soon. So stay tuned for that, and we look forward to further conversations on this topic in future. Thank you very much.
Thank you once again, Lisa. Thank you so much. If you enjoyed this last lightning chat, this is not the last one. So we'll be inviting you next week at the same time for another lightning chat with Francine Gantares-Crepo from WHO, who'll be answering our questions on putting communities at the center, local solutions for large impact. So you don't want to miss this a lightning chat, and the link will be made available through our various platforms as well as reminders. So do not forget also to tell us through on Telegram how you saw this lightning chat. Thank you, Lisa, for being with us here again today and for answering my questions. I want to wish you and everyone here a very nice day, evening, depending on where you're joining from. Bye for now.